So what is spasticity? It's basically a problem of muscle control, and the muscles become tight and stiff and difficult to move properly. It's caused fundamentally by an imbalance of nerve signals from the brain or the spinal cord, causing the muscle to go into spasm. It therefore can be due to any problem of the brain or the spinal cord, such as brain injury, spinal cord injury, multiple sclerosis, stroke, cerebral palsy, and any neurological condition. So what problems can this cause? Obviously it can cause stiff and painful muscles, which can be a problem in itself. Poor muscle control can lead to difficulties with using the arms and the legs. Muscle spasms can be painful and cause all sorts of difficulties with posture or seating. Problems with hygiene, washing, dressing, and other simple day-to-day tasks can all be affected. So this can lead to poor posture, which in turn leads to problems with seating and sleeping. And in the end, this range of problems can lead to complications such as muscle contractures, which means the muscles are actually physically shorter and then can't be corrected by the antispastic measures we're about to discuss. Okay, it's a real difficulty. How common is it though? And it's actually really common. If you look at stroke, somewhere between a third and a half of people after stroke have clinically problematic spasticity that needs treatment. If you take another condition, multiple sclerosis, we did a study in Newcastle of a random selection of people with MS in that city, and we found that about half had clinically significant spasticity which needed treatment. Interestingly, in that study, about half of those who needed treatment weren't being optimally treated. So there's actually quite a lot of ignorance about how to treat and how to manage spasticity, which clearly leads to problems in its own right. We found, for example, that around 25% of those people who needed physiotherapy were not getting it. We found that about half of those who needed botulinum were not getting it. So it's a real difficulty of understanding how to treat and manage spasticity properly. Okay, well, what's the aims of our treatment? We might want to improve function. We might want to prevent those complications. We might want to reduce pain. We might want to simply ease nursing care so the person can be dressed or washed more readily. We have to think of those reasons for treatment so we can tune our treatment to those aims. So how might we want to treat spasticity? The first question to ask is, do we want to treat it at all? It may be an abnormal phenomenon, but does it need treatment? It can be quite mild, and in fact treating it can produce weakness or fatigue that actually makes the matters worse. So we also have to think, is this worth treating or not? And sometimes in our rehabilitation centres, we help the person actually by stopping the treatment they've been put on to help the difficulty in the first place. Secondly, spasticity can be made worse by simple external things such as tight clothing, poorly fitted splints, even, it's said, ingrowing toenails. Anything that can stimulate the person can exacerbate the spasticity. So we might want to simply look at what clothing they have, what seating and positioning they're in, etc. A physiotherapist can also be involved, or an occupational therapist for that matter, with splinting, so a tight arm is held in a nice relaxed position by a mechanical splint. Sometimes another technique is to put a plaster of Paris cast on, say a leg, so the leg is gently moved to a straighter and straighter position with the cast being changed every few days. And we can use what are called orthoses, which are basically manufactured splints such as an AFO, which means an ankle-foot orthosis, so the leg and the heel and the foot are held in a nice, comfortable, natural position. Far better than treating with drugs. But sometimes we do have to treat with drugs. There are a range of antispastic drugs. We have to think, well, who's going to use these drugs? What sort of people would benefit from them? Because we always have to balance the benefit of the drugs against the side effects of the drugs. Generally, those with mild spasticity probably won't benefit from oral medication because the drugs will induce additional weakness or fatigue, and they all have that effect. For severe spasticity, it's often what we call focal. It's often in just one or two muscle groups. After a stroke, for example, the arm can be held very tightly, but the rest of the muscles are perfectly okay. So for those people, you wouldn't want drugs, which affect the whole body. You might want focal treatment just directed to that muscle, which can be, for example, an injection of botulinum toxin, which I'll come to in a moment. So drugs, medication, is probably best used for those in the middle, not too severe, not too mild. And there are many drugs that are available, but the commonest are baclofen, dantrolene, called Dantrium, anti-epilepsy drugs, strangely, gabapentin or pregabalin, Those that people have perhaps heard of, the benzodiazepines, such as diazepam, better known as Valium, another one called tizanidine, and more recently a cannabis product called Sativex has come onto the market, which is very good at fine-tuning spasticity, particularly for those with multiple sclerosis, but any spasticity condition can be helped. For focal treatment, there's two things really you can do. I said earlier that the spasticity is due to an imbalance of the nerve signal. So what you can do to relieve the spasticity is block the nerve, stop the signal arriving at the muscle. And you can do that by identifying the nerve that's at fault and injecting it with a drug called phenol or pure alcohol, both of which kill the nerve. And that can have the effect of getting rid of the spasticity. Not necessarily an easy technique, and not necessarily one that you can do readily at the bedside, but it can be very dramatically helpful. But these days that's not completely but largely superseded by using a drug called botulinum toxin, perhaps better known as Botox, although there are other manufacturers. That's the drug that's well known and well used for alleviating wrinkle lines. But its main purpose in life is actually as a muscle relaxant, and all one has to do is inject the botulinum into the muscle that's overactive. And it spreads within the muscle body and over a few days relaxes that muscle. And that effect lasts about 3 months, and if necessary can be repeated many times. And that relaxation can help the person, or perhaps can also help the physiotherapist to reduce that muscle stiffness and spasm by making it easier to stretch the muscle out. So botulinum toxin has been approved to be really very helpful in the management of spasticity. It's proven to be safe, it's proven to be easy to administer at the bedside. It is also a painkiller, so if there's a stiff, painful muscle, it can alleviate the pain as well as alleviating the stiffness. It's not a treatment in isolation. You still need other modalities such as seating and positioning. The physiotherapist still needs to be involved, but it's a really very useful advance for the management of spasticity. So let's summarise how you manage spasticity. Maybe nothing that needs doing. You need to look at the external factors like the tight clothing and the badly fitting splint. You need to really address the proper seating and positioning in a wheelchair or a comfortable chair. You've got to involve the physiotherapist. You might well want to involve the orthotist, the man who provides the orthoses, or splints from an OT, or casting. You might need to involve a physician to try oral drugs, which then includes nerve blocks and botulinum toxin. There's a few other techniques for a small number of people, such as the use of what's called intrathecal baclofen, which involves implanting a small tube attached to a pump into the spinal cord, and that antispastic drug called baclofen is effectively dripped onto the spinal cord. But that, of course, is for those with real problems, because that involves a surgical procedure to implant the pump and implant the tubing. Sometimes there's nothing else to be done except to relieve that spasticity by cutting and surgically operating on the muscles. But that's an advanced technique, and perhaps shouldn't be done if you've done the previous techniques properly. So it's a technique, if you like, of last resort. So spasticity management is straightforward if you've got a proper team. And clearly we need the team. We need the doctor, we need the physiotherapist, we need the occupational therapist, we might need the nurse, we might need the orthotist. It's a combination therapy. It's a collection of different techniques and different modalities according to the needs of that individual. And the key message is to treat spasticity early before complications arise. And by doing those things, you can make quality of life much better for those with a really troublesome problem of spasticity.